Good evening, everybody. I hope we are all well. My name is Dr. Rose Muhindo. I'm a physician and a kidney specialist employed by Mbarara University of Science and Technology. And I work at Mbarara Regional Referral Hospital as a doctor. I teach. I'm a senior lecturer in the university. And my daily work really is to look after patients with general medical conditions, but particularly with patients who have kidney disease. Let me take off my mask for purposes of increasing audibility. Thank you very much.
Good evening, our dear viewers, and you're welcome to today's show. So my name is Dr. Kansime Grace. I am a physician as well at Mbarara University. I teach students and see patients at the Regional Referral Hospital, and I'm also a kidney doctor. So you're welcome to today's show. And the purpose of today's show, as we talk to you as doctors, you must be wondering why doctors are here today. We're here to talk to you about kidney disease, as you've heard that we are kidney doctors. So for you maybe to hear me very well, I'll also take off my mask. So allow me to take off my mask so that you can hear me very well. So as kidney doctors in Uganda, we are also part of the Uganda Kidney Foundation, and really it's who we are representing today. So every year in the whole world, we celebrate what we call World Kidney Day. And this is a day mostly for patients, for awareness, for those that do not have kidney disease, but also for patients to know that the whole world thinks about them and wants to make kidney disease better for them. So this year is usually celebrated in the first week of March, actually every first Thursday of March. And for this year, 2022, it will be on 11th March 2022. So in 2 weeks' time, really. And today we are going to talk. So we are going to have a series of talks about kidney disease. And for our first talk today, we are really going to talk to you about the normal kidney. What is the use of the kidney? And briefly, if you had kidney disease, what are the things that maybe you would see on your body that would tell you or make you think that you may be having kidney disease? So, and every year, maybe before we go into that, every year when we celebrate World Kidney Day, we have a theme for World Kidney Day. And for the past 3 years, the theme for World Kidney Day has been kidney health for all, with sub-themes, maybe focusing at patients, focusing at the general population. But for this year, the focus is bridging the gap, the knowledge gap. So we know that most of you out there, you hear things from other people about kidney disease, maybe how it presents, or if you are a patient with kidney disease, the things you'll experience, how you should treat it. Some of you are told to use herbs. Sometimes you think, for those of you who are in Mbarara, you may not know even that you have doctors for kidney disease here in Mbarara, and actually you may have been thinking maybe you have to go to Kampala, but today you know that we are actually even 2 at Mbarara Regional Referral Hospital. So the theme for this year is to bridge this knowledge gap. So in this series of talks, we are going to educate you. We are going to educate you about kidney disease, what it is, where you can seek help, where you can find us, and so that's really what we're going to be talking about. And we hope that as we give you this information, we improve kidney care in general. So
thank you very much, Dr. Kansime, for that lovely introduction. And we do hope that you enjoy the next series with us. And we also hope that by the time we complete this series, we'll have enough people motivated to join this wonderful specialty of offering kidney care. So what are the kidneys? So kidneys in general, I think when you ask people on the street, everyone will have their own definition. People, depending on what language you speak, most people locally will use the word like ensigo, but you'll find that in certain languages, ensigo can mean kidneys in one language, ensigo can mean something else in another language. But generally speaking, kidneys are organs that are part of, we'll say, internal organs that we have. They are located in the abdomen, but behind, so at the back, really, what we would medically say that they are behind. They are not exactly where people think they are. So most people, if you ask them where are your kidneys, they'll touch maybe somewhere here or here. But anatomically, we know that these kidneys are actually going to be at the back towards the end there. So now, God created each one of us, particularly to have at least 2 kidneys, 2. Some of us might not actually have 2. Unfortunately, some people do not even know whether they have 1 or 2. We don't know whether they have normal sized kidneys. We don't know whether they have 1 small one, 1 big one. But in normal circumstances, every human being is meant to have 2 kidneys. When we are teaching our lectures, we'll say that there's a reason why God gave us 2. And as we go on, we shall see that we can actually share these kidneys even with people who have been unfortunate enough maybe to have loss of their kidney function, and then that's when they get a transplant. But in normal circumstances, these organs will start to develop like any other organ that is in your body internally, and they will increase in size up to a certain size. We normally want to think about a kidney like a bean-shaped structure. Within it, it has very tiny structures, if I can say, that actually help that organ to do its function. There are millions of these structures in these 2 kidneys, and these actually do a lot of work on a daily basis. Per minute, they are working every single time. So what I'm trying to say is that each of us at least has 2 kidneys. They are internal organs, and we will try to see what happens if these kidneys are not working properly. But before we do that, we need to ask ourselves, what do the kidneys actually do? So what is the function of the kidneys? Dr. Kansime will take us through that.
Thank you very much, Dr. Muhindo. So we all know, we all pass urine. And maybe as people grow old, we know that in old age urine is golden, because that's when most times we tend to have kidney disease, and patients will not maybe see their urine as they used to see it. So when we are young, we pass urine every day, several times, and we take it for granted. We never think about it. So for most patients, they will think, oh, maybe I have a problem with my kidney, when they are not passing urine, or when they fail to pass urine, or when the urine reduces. And at least everyone knows that, oh, urine comes from somewhere, and we all know that it's made by the kidneys. But maybe what we don't know is that at the time that we pass urine, or when the kidneys are making urine, they are actually cleaning our body. So when we eat food and drink, and as we go about our normal activities, the body is working, and every thing that works produces some products, some waste products, which we call waste products, which should get out of our body. And in order for our body to keep working well, those wastes have to come out. So the kidney is this part of the body that cleans our blood and removes the wastes, and these wastes come out in urine. So when the urine comes out, it is not actually just the water. So the kidneys will remove excess water because we drink, but also the body, as it does its work, it makes some water. So the body uses the water that it needs for that day, and the excess that it does not need comes out, and this comes out in urine. So that's one function. And as we go on, that's why you'll see that patients who have kidney disease start swelling, because they cannot pass the excess water. So one of the functions is, and the one that we all know, is that it takes out the excess water and we pass out this in urine. But as we see, the water we drink and the urine that we pass, they are totally different. So it means that there are other things that are in this urine, and these are the wastes that we are talking about. So it means that if your kidneys are not working well, they will not take out these wastes. So look at your kidney as a sieve. In Runyankole akajejena, in Uganda akasengeja. So, and in other languages as you can think about it. Yeah, Dr. Rose wants to tell us what it is in Ukondo. Okay, so look at your kidney. So look at your kidney as a sieve. So imagine when you're making juice and you have your passion fruits and your oranges and everything, and you blend them and you want the juice to come out and other things to stay, so to stay up in the sieve, so they don't come in your jar of juice. So when we have blood, as blood goes through the kidneys, so the kidneys, they go through that sieve. I mean, the blood goes through that sieve, and as the blood goes through that sieve, it sieves out the excess water, which will go to make urine, but also it sieves out the waste products. So the waste products go with the water and they will come out in urine. Then there are things that are in blood, including blood cells, including proteins, including some minerals that should actually not get out of blood, should remain in blood. So that sieve should make sure that it removes the water, it removes the excess minerals, it removes the waste products, and those will go out with the urine. And then the things that are supposed to stay in blood actually stay in blood. And we are emphasizing this because sometimes in disease, you may not be swollen, but you may be passing things that you're not supposed to be passing. If your sieve is not working well, things that are not supposed to go through may go through. That is also kidney disease, because it shows that your sieve is not working well.
Actually, you've said very well. Just to re-elaborate, as she started using the example of the sieve, if you're making passion fruit juice, if you see any of the seeds in your cup, because originally your cup is meant to trap only the good juice and not the seeds should remain up. So if you see the seeds now going through, although now in this case the seeds are not supposed to go through, but now imagine that was a blood cell or protein. If you're seeing it leaking through, it just means that something has damaged your sieve. Either there's basically some disease process in this particular case.
Thank you, Dr. Rose. So now we know three functions of kidneys. It takes out excess water, it takes out the waste products, and it makes sure that things that are supposed to remain in blood remain in blood. But there are other functions that we usually don't know as people out there walking around. So when we take out excess water from our body, we also control our blood pressure. So the kidney is an organ that helps us to control blood pressure, to keep our blood pressure normal. So if you get kidney disease, you actually get hypertension or high blood pressure. So the kidney also controls our blood pressure. And then, when we eat food, food has a lot of minerals, all salts, call them salts or minerals. And these minerals are very important in our body. We need them for our muscles to work, for our heart to work, for our nerves to work. So when we take them in food, the body removes what is enough for it, and the excess go out in urine as well. So the kidney balances our minerals in the body, because when these minerals become too much, then the body will not work as it should work. So that's the other function of kidneys. The kidneys also help us to make blood. So kidneys are wonderful organs, as you can see. So you thought that they were just for making urine, but now you can see very many functions. So the kidneys also help us to make blood. So they make a hormone called erythropoietin. You don't have to bother with a name, but they make this hormone, and when they produce this hormone, this is what takes the message to the bone marrow, to tell the bone marrow that, hey, make blood, this person needs some more blood, either they had an accident and bled or something happened, so make more blood for them, they need more blood. So if your kidneys are sick, it means they will not produce that hormone, and so that hormone will not take the message to the bone marrow that you make blood, so your blood level will be low. So if we can recap, the kidneys make urine, they remove the excess water, they remove the waste products, they balance the salts for us, they control blood pressure, they help us to make blood, and there is something called acid of the blood, not this acid of juice and mangoes and oranges, no, but the blood. And that also is very important because our body cells can work at a certain we call it pH in the medical language. So if the body becomes too acidic or the other way, too alkalinic, the body cells will not work, they will die. It is also the kidney that balances that system. So if the kidney is not working, it means that system will not be balanced, so your body will not work well. So really, as you can see, usually as I talk to my patients, I tell them that imagine if you are living in a house and every day you're passing urine in that same house, or maybe even stool in that same house, and you pass urine today, you don't pour it, you pass urine the next day, you won't pour it. After 3 days, you yourself, you'll feel like you can't live in that house because it will be smelling, it will be stinking, you can't eat food from there, you can't drink from there, you really can't withstand the smell. So look at your body as that, your body cells. If the kidney does not remove the waste product, the environment of the cells will not be okay for them to work. So the cells will not be happy, you will fall sick, and that's when you come to us in hospital. So briefly for today, now we know the kidney, we know we have two, most of us, we know the functions. So Dr. Rose is going to tell us briefly what happened, a few of the kidney diseases, not really elaborating, and the usual signs that we see generally when we have kidney disease. And then we shall elaborate more about kidney disease and kidney failure in the next series.
Wow, thank you very much, Dr. Kansime, for such an elaborate presentation. So the next part, really, now we have learned all the functions of the kidney, and we actually realize that these two organs, small as they might be, actually, I always tell my students that the most important organs in the body are only two, the right kidney and the left kidney. But nonetheless, so what happens in kidney disease? So we have very many types of kidney disease, and kidneys can be affected just like any body part that could be, and depending on how you're thinking through. We always like to teach our students and say, when you're thinking about causes of something, you want to categorize them. In this example, I might say that kidneys can get infection. Okay, so even kidney infection is kidney disease, right? I keep hearing people saying, oh, somebody has a UTI or a urinary tract infection, that alone is kidney disease. Kidneys can also suffer different types of diseases. So just before I go into that majority, we like to talk about kidney diseases in the sense that somebody has an acute problem. In this case, we are meaning someone's kidneys were well, and within hours, days, weeks, less than 3 months, they have a problem now. Normally, we will call that acute kidney injury. We don't say acute kidney failure like in the past, because we believe it's a reversible process. All these other things that Dr. Kansime has been talking to us about can actually get affected. But in acute kidney injury, these things are actually potentially reversible. So kidneys can get into acute kidney injury from many causes, really. We say the infection, but even dehydration. Someone can have diarrhea, vomiting, and then they will get dehydrated, not enough water in their bodies, the kidneys won't be happy, and then they'll shut down temporarily. Somebody can also get let me say poisoning or some kind of toxicity, maybe you've eaten something or someone has given you something, that can also affect the kidneys. Kidneys also can suffer injury from use of herbs. Most people would like to find a herb for everything, this shaka for this, for that. So some of these things we don't know what the content is, but we also know that they can be very dangerous to the kidneys. Patients can get acute kidney injury for many things. I'm only just going to try and highlight the major ones, but as we know is that even the medications that we give our patients, unfortunately, some of them can actually damage the kidneys. The beauty about this is that if you recognize this and you withdraw that medication, then you can actually reverse or improve the kidneys back to their normal function. Other procedures that we also do to the patients and also affect them, their kidneys. Let's say we do CT scans, you go to the radiology department, they need contrast. They give you this contrast. It can also cause a kidney injury, unfortunately. Then generally speaking, the commonest cause of kidney injury can be infection. So patients will come with a bloodstream infection, which we call sepsis. This literally affects the hemodynamic status of the body. So the perfusion or the balance or the water, like blood reaching the kidneys can go down because of sepsis. And actually that's one of the commonest causes of kidney disease or kidney injury, so to speak. Patients can also have kidney injury as a result of other underlying medical conditions. That would normally lead us to now what we call chronic kidney disease. So chronic kidney disease is when patients have been suffering with, we'll maybe elaborate this in the next series, we've been suffering with kidney issues for more than 3 months, whatever that will be. But this is commonly caused by underlying conditions. The biggest one of these is actually diabetes. We know that these diseases are diseases that are actually increasing. These are diseases that we call non-communicable diseases, and unfortunately they will affect the kidneys in the long run. The other one is that patients can also have chronic kidney disease because of having high blood pressure. And here maybe I should elaborate. So high blood pressure, if it is poorly controlled, it will damage various organs, including kidneys, including the heart, the eyes, and people can get strokes from those. But on the other hand, kidney disease itself can actually be a cause of high blood pressure. Okay, so these two things actually can form a cycle, and it would require that patients get balance. At least one of these things has to be controlled. So apart from diabetes, apart from high blood pressure, patients can also suffer from kidney disease, unfortunately, if they have other disease conditions that we would normally call glomerulonephritis. So that is a concept like Dr. Kansime was explaining about the sieve. So if you have diseases that affect the sieve or the filter of your kidneys, that disease term generally is glomerulonephritis. This can happen in the short term, where we call it acute glomerulonephritis, or in the long term, where we call it chronic glomerulonephritis. I won't bother us too much with all the details. Yes, the kidneys can also suffer because maybe people have cancer, and the cancers are affecting the kidneys, or the cancer medications are affecting the kidneys. The kidneys can also suffer. So you can get chronic kidney disease also if you have some genetic abnormalities. We do unfortunately have patients who would have some disease conditions like polycystic kidneys, meaning that the kidneys are full of multiple cysts. This is an inherited condition, if I can use a simple word. And these are some of the things that can also cause chronic kidney disease. The list is endless. The list is quite long, but I think for the start, that's just a brief overview of the different types of kidney disease. I remember I said that we say kidney injury, so we do not say kidney failure. And where we draw the line between these two diseases, acute kidney injury and chronic, is we believe that the patients who have acute kidney injury, there is hope for recovery. It's a potentially reversible condition, as opposed to chronic kidney disease, which we shall tackle probably in another lecture. These patients are the ones who will need help with lots of other treatments. Have I exhausted the list or?
Yes, more so. So, as just to add on to what Dr. Muhindo was telling us, so our patients also who have HIV, all the medications actually for HIV. So as you can hear, any of us, usually what I tell my patients and what I'm telling our viewers today, anyone can get kidney disease. Everyone should remember that, be it a child, it is not a disease for old people, be it a child, be it a young person, be it a pregnant mother, maybe when they are delivering, they can lose blood and they end up with kidney disease. You can be walking around and you get an accident, you lose blood, and at that time your kidneys are not getting enough blood, they get injured. So what Dr. Rose was saying as acute kidney injury, all now our old people maybe who have had diabetes, hypertension, if you get a cancer, so anyone walking around can have kidney disease.
Even COVID can cause.
Yes, now we have COVID. We now have COVID, even COVID can cause kidney disease. So as we walk around, if you're 60 or if you're 70 and you've not had kidney disease, you should really kneel down and thank your God, because you've really survived a lot. There are very many things that can cause kidney disease. So in our next series, we shall really talk about the symptoms of kidney disease, and then elaborate more about kidney failure and the options for treatment, and also maybe prevention or what you need to do. But as you can imagine, as we talked about the functions of kidney disease, so in the symptoms, as we talked about the functions of the kidneys, so the kidneys don't do their work well, so you won't pass urine well, you will not balance your salts well, you will not make enough blood. So if you really listen to the functions of kidneys, you can almost know what will happen to you when your kidneys are damaged. The only bad thing is that most of these things happen when a biggest part of your kidneys have been damaged, what we call late in the disease. So that's where we have a biggest problem, and that's why we are here today educating you, so that if you have those diseases, check your kidneys, check that they are functioning well. Every time you go to your doctor, check that your kidneys are still functioning well. Because by the time you say, oh, I am swollen, my kidneys are not working, almost 80% of your kidneys are gone. And we are going to discuss this further. So for today, we shall end here. And we thank you very much for listening to us. You've been very good viewers. And we thank ATTV for giving us this opportunity to educate you. And in our next series, so as you view this today, in exactly 1 week, we shall be celebrating World Kidney Day. And just remind you about the theme. It is Kidney Health for All, with emphasis on bridging the knowledge gap for better kidney care. So we hope that when everyone is equipped with the right knowledge, you can seek care from the hospitals. Maybe you won't take herbs, or you won't take some medications that are not prescribed and they affect your kidneys. If you have diabetes, you know that you should check your kidneys. So we hope that when we all have the information, then we shall better take care of ourselves and keep our kidneys healthy. So once again, much as we work with Marara Hospital and Marara Regional Hospital and Marara University, we are really part of Uganda Kidney Foundation, and we welcome you to join us. So Uganda Kidney Foundation is not only made by doctors and nurses, it is also made by, we have patients, we have well-wishers. So if you're out there and you're wondering how you could contribute and help others, or even learn more, you're actually welcome to come and join us as part of Uganda Kidney Foundation media houses. If you want to partner with us and always give us slots to educate the people, you're welcome to join us. And maybe as we leave, I can leave you with my contact. Don't call me to ask about disease. You can call me and I direct you to come to the hospital and you'll find me. I'll help you. So again, my name is Dr. Kansime Grace and my phone number is 0774 233498. 0774 233498. Thank you very much for today. until next week. Maybe next week we shall really be talking about kidney disease, the symptoms and the treatment. May God bless you until we meet again.
Thank you.